Let's see. It looks like it's recording now. Great. Welcome, everyone. Welcome to this new series of Alanda webinars. My name is Candela Iglesias. I'm a global health specialist with a biomedical background, and I'm the founder and director of Alanda. Here today with me are two of my team members, Asil and Julius, and they will be managing the chat. And if I forget anything or I can't see your questions, they will remind me. I'm very happy to have you all here today. This is a bit of an experiment that we're doing, a new type of webinar that Alanda is planning, where we're going to be focusing on themes related to evidence. And we want to hear a little bit about the challenges that everybody's facing in this space relating to monitoring, evaluation, sharing of results, measuring impact, all of these good things that we should be doing and we want to do better. So yeah, basically we want to hear from you. I am going to start with some, by touching on some points that I see regularly, but most of this is going to be a two-way conversation. So hopefully you'll be super interactive and super participative because this is, yeah, basically we want to hear from you. I told you a little bit about me. I founded Alanda 5 years ago, but I've been working in the global health space for the past 10 years, plus 10 years, and in the research space for the past 20. So I've worked with a lot of different organizations, governments, NGOs, multilaterals, etc. And we've seen a lot of the different challenges that organizations and individuals are facing in monitoring and evaluation. So we're trying to cover some of those here. What we're going to be doing is instead of the word association, we'll do a little poll that I just prepared just to know a little bit more about who's in the room. And then I'll be talking about 5 common mistakes in developing indicators. And this is just an excuse to delve into the topic and to open it up for question and answer and discussions. I don't pretend to have all the answers, but together as a communal mind, we probably have a lot of good answers to questions people may have. And then I'll briefly present the way Alanda works with evidence and the framework that we have that might be helpful to you in your work as a way to conceive of what's the best use of evidence across the project cycle, and a little bit about where we want to take these webinars going forward. So let's start with a little poll. Here we go. It's just to know a little bit of who's in the room. Can you see the poll? There's 3 questions in the poll. Can you see it? Let me see if my team is saying if they can see it. Yes, perfect, great. Go for it. So if you can answer those 3 questions for us, it'll give us a better idea of who's in the room today and how we can help and support you best. Oh, nice, very colorful. We have 2 people who have answered, 5 people who have answered. Great. 17 people we have in the room today. That's awesome. You have people from Atlanta in the US, someone else based in the US as well, people from Bangladesh, the Netherlands, San Francisco, Egypt, Palestine, Malawi, Ukraine, Kenya. Great. This is fantastic. So international. And for those of you where it's very late, thank you so much for joining, even though it's nighttime for you. Okay, I'll give it another minute. If you haven't answered, please do. We want to know who's here. 11 out of 18, that's great. Someone changed their mind. Okay, I'm gonna stop it there so we can go on. But yeah, just feel free to type in the chat as well about who you are and where are you joining us from. Thank you for answering. So, where do you work? Larger, medium-sized nonprofit, 21%, small nonprofit, 37%, UN organization, no. The UN organizations are in turmoil right now. That's normal. Foundations, academia, great. A lot of monitoring evaluation people, yay. A lot of project or program management and some health or WASH or research positions, great. Most of you work a lot with M&E, which is great, so we'll be learning from each other today. Thank you so much for answering. This is great, gives us a good idea. Okay, let me go back to that presentation. Let's get started with 5 common mistakes that we have seen when we work with organizations in developing indicators. Just to set the expectations of this webinar, this is not an M&E 101. We're not going to be explaining what a log frame is. We're not going to be explaining what an indicator is. Clearly, you all work in M&E. You all know these things. We're just going to be talking more about the real life challenges that everybody's facing and what can we do to improve on these challenges. So the first mistake that I see a lot is measuring only what's easy instead of what matters. And what this normally translates to is stopping at the output level. It's very easy to measure outputs. And, output indicators tend to be very simple, right? They are just a number. It's not like a percentage or a proportion. It's something like number of trainings conducted, number of water tablets distributed, number of latrines built. It can be many of these things, which are quite easy to measure in a way. And easy, it can get tricky, depending if you have a very large project. But more or less, these indicators are not complicated. I see so many organizations stopping at this output level. And that does not allow you to show impact to your donors, right? What we want to do is, apart from the output, so it's great that you're measuring output, but also go one step forward and measure outcomes. For example, and I see this especially with trainings, this is very common with trainings. I don't just want to know how many people were trained. I want to know what proportion of the participants in the training are still applying the learnings from the training 3 months afterwards, for example, or 6 months or a year, right? And this is something that I see a lot. When it comes, for example, to number of items distributed, if you're distributing water tablets or if you're building latrines, what you want to measure is access, right, or coverage. And these things are not usually measured. So you also want to have an indicator that is a proportion or a percentage of people in the community that have access to safe water. And what you want to do is to compare that from the before your project to after your project, to the end of your project or the midterm of your project or whatever it is, right? So outcome indicators are not something that we measure necessarily in a monitoring fashion, right? We might measure it at the end of each year if it's a multi-year project, or we might measure it at the beginning and at the end of the project, sort of if you have a baseline and then you have an end line. But these are very important to showcase results to your donors, because what you want to eventually, and this is at the outcome level, but eventually this will also, it allows you to get one step closer to the impact level, right? Are these changes in behavior actually, due to the training, actually creating results, right? If you're training community health workers on how to do household visits to invite pregnant women to give birth at a hospital, for example, is the training that you're giving to your community health workers actually having the impact that you want? Is there an increased number of pregnant women that are giving birth at the hospital, right? So, measuring all those levels and not stopping at the output level is super important. Oh, great. People are sharing their LinkedIn. That's fantastic. Please do. Let's create community here. Great. So that's one of the most common mistakes I see, especially with smaller organizations that have less experience with M&E. And then the other, and this one is so common, I see it in government documents, I see it even in UN documents, I see it a bit everywhere, is ambiguous or vague or overly broad indicators. And what this normally looks like is confusing indicators with objectives. I mean, it's very good that you're clear on your objectives, but then you need to develop a very specific way of measuring that you achieve that objective, that you reach that result, right? And that is your indicator. So there's some confusion around objectives and results and indicators. So normally an objective is we are going to do ABC, right? And the result is we did ABC, but the indicator is the way you measure how you did A, how you did B, and how you did C. And that vagueness, for example, one of the community well-being improved. I mean, that's great. That's what you want to achieve. That's fantastic, but that's not an indicator, right? So I'm guessing you see this a lot as well. I'm not a big fan of the SMART acronym, but basically what's missing here is the specificity, right? What does well-being in a community look like? How do you know when you have improved it, right? If you can answer that question, then you have a good indicator, right? So for example, here you could use percentage of households reporting access to safe drinking water in the last 30 days. And you're going to compare that from your end line, from the end of your project to the beginning of your project. And if you increase that, that might mean that community well-being is improving, right? So you need to define what community well-being means for your project. And that doesn't mean that other projects will have the same definition, but what does it look like for your project, right? This is something I see a lot. Great, people are still joining. Welcome, everybody. Thank you so much for coming. Mistake number 3. This one is... So let me tell you a bit of a story. Let's start this one with a bit of a story. So this is just last week. A colleague of mine calls me and says, "Hey, Candela, can I pick your brain for 5 minutes? I have a challenge in M&E." I'm like, "Yes, let's talk." And she's a great M&E person. She's worked in many fantastic organizations and she's very strong. She says, "Look, I'm working with this organization, and the way they want to measure results going forward is they want to request the organizations that they're funding to redo their budgets every 3 months and use the budgets to measure how much are they actually moving forward, to measure performance." And I make like this big eyes like, what? This is insane, right? This is like, people on the ground are there to do a job, and that job, the most important part of the job, is implementing, right? So we as monitoring and evaluation people need to make sure that whatever we're asking from the people doing the work is feasible, is as easy as possible. We need the results. It's super important that everybody understands in the team that the results are needed, that we need to measure, that we need these indicators being measured, that we need that data collection. However, we need to make it as easy as possible for the people on the ground. So this I see a lot, right? Too many or too few indicators, but it's usually too many. Lists, overwhelming lists of 40, 60, 100 indicators. That is never going to get measured. People on the ground are implementing. They don't have the time to measure 100 indicators, right? Updating this every 3 months, is that really necessary? What do you really need to measure? And I would challenge the notion that you even need to measure all outputs. Maybe you don't need to measure all outputs. What are the key outputs that you need to measure? And as you move forward in the pyramid, as you move upwards in the pyramid from outputs to impact, normally you would have less indicators, not more, okay? So because the outcome indicators are the aggregation of a lot of the outputs that you put in, so they should be less than your output indicators. And then when you're measuring impact, you're measuring improvement in health, decrease in number of deaths, decrease in number of cholera cases, etc. So these are the culmination of all your outcomes in a way. So you should have less impact indicators than you had outcomes, than you had outputs, right? So really, we need to, as many people, we need to push back and say, hey, do we really need this? Let's think about what's the most important thing here, which is actual implementation, right? And can we talk to the donor? And normally this is donor created, right? Donor created pressure. Can we talk to the donor and explain that this is just insane, that we can't measure all this, that we will spend so many resources? If you're spending more resources in monitoring and evaluation or research than you're spending in the actual projects, something is wrong, right? We do see the other side, I guess. I don't know, in your experience, how much of this do you see? But we've also seen not enough indicators. So focusing on maybe one or two dimensions, but maybe, and some of the most forgotten ones tend to be quality or user experience. And I guess this is uncomfortable to measure because this is where, things get really authentic. And this is where we can hear back from our end users, from the communities that we support, on whether the program that, or the project that we care so much about, is actually changing things in a positive way for them. And it's hard when you hear that it's not, right? Or it's hard when you hear that it's not enough, which is usually the case. But we still need to do that, right? Not just tracking service delivery, but also tracking quality and user experience. And what I also see that is usually forgotten is coverage. And coverage has to be a percentage, right? You can do it by geographical zone, you can do it by population if you have good denominators, but basically how many people are getting this service or this benefit or this output or this outcome, right? Which brings me to denominators. How many of you have been having trouble because you don't have the correct denominators? This is a real thing that most of us will encounter at some point. If you're measuring proportion or percentage of people that were vaccinated, right? And I kept seeing this in, oh gosh, I can't remember. It was a measles outbreak somewhere, some years, like 10 years ago or something. And they were vaccinating children, and the percentages of coverage said that they had, I don't know, like 105, 110% of children vaccinated. And there were still cases. There was outbreak cases. So it's like, why? How is this happening if the children are vaccinated and you have 110%? And then this very wise health officer, I think this was in Burundi, I think it was in Burundi. He came to me and he said, look, I mean, these denominators, they are from the past census. This census happened 10 years ago. It's probably not the correct denominator. It's probably not the correct number. So it's not really 110. Every time I go to supervise my vaccinators, there's more children than what we have vaccines. So the denominator is a challenge, right? So whenever things look weird, just double check how good is the quality of the data that informs your denominator. Census data is many times used. There might be some local data that might be better, and I've found that normally community leaders will have a better, in smaller communities, rural communities might usually have like a better number that is more updated than whatever the official data is saying. But yeah, so when you're thinking about coverage, if you're hitting the wall, take a good look at your denominator. I've had this happen to me many times. Great. Mistake number 4. Oh gosh, this happens a lot, doesn't it? Indicators not co-created with stakeholders, communities or frontline staff excluded. This creates 2 problems. The first one is there's no buy-in. If the people who are actually going to do your data collection have no idea why are they collecting this data and why is this important, I don't think they're going to care. They're not going to prioritize that, right? So we need that buy-in. We need to bring the people in. And I remember like 15 years ago, I was working at this hospital in Mexico City. And I was like, but wait, why don't we have this data? We should be knowing which patients are coming back and which are not. And I started talking to the frontline staff. And this was admin people, right? The people at the reception that were typing in the data. These were not the doctors, this were not the nurses, these were not the social workers. This was like the receptionist. And when I started talking to her, she was like, well, you know how much data I have to input every day? So if I don't have time, if there's a huge line of patients, I just skip this step, or I just put the name, but I don't fill out the rest of the form. I don't have the time. What do you want me to prioritize? And she was totally right. I mean, this is an extra burden. And if people don't know why they're doing it, or if it doesn't make sense to them, or if it's not well integrated into their process for implementation, it's not going to happen. And you're going to have missing data, right? So we need to co-create indicators with our frontline staff, with our officers, our project managers, vaccinators on the ground, with community leaders, with community members. They know what's possible and what's not possible, right? They know what challenges, they can tell you exactly what challenges you're going to face. We were developing this I was supporting the Red Cross in Burundi many years ago, and they were working on cholera prevention. They were very clear on what they wanted to see. And then when we started talking to the community volunteers, some of the people wanted to measure decrease in number of deaths from cholera. And a community member just told us, that's not going to happen. No one's going to tell you what that person is dying from. I mean, that's intrusive. There's stigma around cholera. It's not going to happen. You're not going to be able to measure that. So we need that reality check-in from the people in the front lines, from the people in the communities. And if you're not having that, your indicators might not work. I've had discussions with community health workers, and they were like, okay, you want me to adhere to this household visit protocol, right? And you want me to ask all these questions from the pregnant woman in the household. But if I come in and the woman is, attending to the food, to the children, to this and to that, I maybe have 5 minutes, or maybe this person has some other problem that they want to talk to me about. Do you want me to shift that conversation to answer your questions, or do you want me to actually provide a good service to the person, right? We need to adapt our data collection tools to what's happening on the ground, to make them flexible so they work for our frontline staff, for the people who are actually doing the implementation, right? So what we want in the end is to have clarity on user satisfaction and results. What we want what we want is increased breastfeeding, and interrupting that conversation that the community health worker is having with the mother to answer the questions in the protocol will not help increase that breastfeeding. Then what do we do? And this is something that, as many people, we need to be very conscious about, and we also need to pass that information forward to our donors, to our managers, etc. They need to understand that the most important thing on the ground will always be implementation, and monitoring and data collection need to be embedded as easily as possible so as to not interrupt, but on the contrary, reinforce whatever is happening in terms of implementation. Hi everyone. Hi all the people who just joined. I see people from Uganda and Liberia and Mexico. Welcome, welcome. Great. So that's mistake number 4. There was something else I wanted to say with this about this. Oh, yeah, there's the opposite thing as well. Too many stakeholders getting their hands onto your indicator framework. Okay, this has happened to me many times. It's probably happened to you. You developed your log frame, you developed a set of indicators, and then you shared with different stakeholders, the donors, partner organizations, other people in your organization who have a say, other stakeholders, etc. And everybody comes back with more indicators to add, or with tweaks to your indicators, or whatever it is. What do? Do you just take them in and add them? Or do you review them? Do you have a process for what gets accepted and what does not get accepted? If you don't have a process, if you just go ahead and add them, you will end up, and I have ended up, with a monster indicator table that makes no sense, where there's a lot of repetition, where there's things that are not going to be able to be measured, etc. So it's great that we involve other stakeholders, but it needs to be a back and forth. We need to feel empowered to push back, to say, hey, listen, thank you so much for your feedback. This is why I created this indicators this way. We have had a check-in with the frontline staff. We've had a check-in with the communities. This is what people think can be monitored. This is what people think can be measured. Your indicator, we've tried it in the past, it doesn't work. Or this indicator that you're proposing, do you have data on whether it has been tested before, whether it has been used before by other organizations? All the indicators we are proposing have been tested in the past, right? So there's a lot of people with very good intentions trying to improve our monitoring and evaluation framework, our set of indicators, but we need to have these conversations with them. We can't just accept everything. If we do, we have that risk of ending up with a monster thing that doesn't make sense and will not get measured, right? Meaningful, useful, measurable. That's what we want to get in the end. Okay, let's go on to mistake number 5, and then I'm just going to open for questions and answers. Mistake number 5, we've all been there, we've all seen this. I'm sure you have plenty of stories like mine. Data for data's sake. There's no clear plan for the use of data for learning and improving projects. So mostly it's passive. We are collecting this data because the donor requests it. And if we want to keep our donor happy, we have to collect this data. What that turns into is, if we have 5 donors, we have 5 different sets of indicators. It gets completely out of hand very quickly. What we want instead is to be using that data. I have seen so many organizations that don't use their monitoring data. Evaluation data is different. Evaluation happens at the end or at the midterm of a project, and that is to inform your next project or your next phase of the project, right? But monitoring data is there for a reason, and that reason is continuous improvement of your project. When you see that project cycle, the monitoring data is supposed to get reinserted into your project cycle, right? All the time. So if you're having quarterly monitoring data, you should be discussing this in team meetings. You should be discussing this with frontline workers, with supervisors, with community health workers, with the hospital staff if you're working in a hospital, with the communities. We should be sharing these results and trying to understand, why are these things happening, and using the data to improve our projects, right? And I think we also play a role as monitoring and evaluation people in pushing for that, in saying, hey, if you're going to make me collect this data, we'd better be discussing it, right? We'd better be incorporating the learnings from this. this is the data from this monitoring. What are we learning? Do we need to actually go back and have like an interview or focus group discussion with the people to understand why does this data look like this? Why do we have a decrease in the number of outputs? Why do we have an increase in the number of people washing hands? Is it just because what is working? What exactly is working so that we can do more of it, right? Or what is not working and we need to change? Now, caveats to that, definitely, it's hard and many donors don't allow the flexibility for you to change indicators as you go along, or to drop some indicators and start using others. But that doesn't mean that you can't tweak the project per se. And I think most donors are realizing that very rigid projects tend to do worse than when the donor has the flexibility for the organization to change as they learn and as they go along. And it's also, our job to talk to our donors and explain what we're learning and what that means in terms of changing or improving the project going forward, right? But yeah, I love it. I see this very rarely, but I love it when I see a monitoring and evaluation framework from an organization that has a clear data plan. This is how we're going to analyze the data, and this is what we're going to do with each piece of the data. This is going to go to our donor reports. These pieces of data are more important for our weekly or monthly or quarterly team meetings. These are going to be discussed in a learning again for our organization. And when we have the evaluation data, we actually want to publish this in a conference abstract, to go to a conference and present it to other organizations so others can learn from what we are doing well and from our mistakes. That learning is usually missing, even though most of the positions now have the L at the end for monitoring, evaluation, and learning. That learning process, I still think, is missing quite a lot. And I'm happy to hear what you are seeing in your organizations. Great. So I want to open this for discussion. I want to hear your questions. I want to hear your challenges. I want to hear your thoughts on what I just shared. But before we go there, I do want to mention some caveats, right? It's very easy to stand here and just say, oh, this doesn't work, this doesn't work. These are the mistakes that I see. The reality is developing and using meaningful indicators is hard. For many reasons, you know them as well as I do. Monitoring and evaluation gets limited budget. Sometimes they want us to do something that would require, more funds than the project is actually getting. Good monitoring and evaluation takes time, and there's normally, if you're asking this from your project manager, they might not have the time. They're too busy with implementation. So it's good that you have also someone else that can support in the monitoring and evaluation. And then there's something to be said, and this is very important. And I think it's finally, it's like it comes and goes in waves. I've seen these waves come and go over the past 20 years. It's what I call the stories versus numbers balance. It's basically your qualitative versus your quantitative data. And I think donors want both. They want the stories because stories are much more powerful in terms of telling the impact. But they also want the numbers because the numbers are going to tell them the actual coverage, the actual number of lives that your project is changing. So there has to be a balance, and we need to remember to collect both. It's not an and or. It's not an or question. It's not, do we want qualitative data or do we want quantitative data? If you're doing this correctly, you have both. And there's many more methodologies, and we can talk about those in a different webinar, but there's more methodologies coming out for how to use stories to showcase impact. I'm a quanti person, so disclosure, I'm mostly a quanti person. I truly believe in the power of stories, but I believe stories need to be complemented by quantitative data. So even these great methodologies to show impact through stories, I still think need complementation with actual quantitative data whenever it's possible to measure that. And the last thing I wanted to say is, we all know this, attribution is tricky, right? And this is also something we need to educate our donors and our organizations about. If you're measuring at the impact level and sometimes even at the outcome level, right? Proportion of people in your community who now have access to safe drinking water, it might be you, but there might be other organizations also working in that community. There might be the community themselves that, now has more money or more resources and are building their own access to safe drinking water. So what part of that can be attributed to your project or your organization is always going to be tricky. To answer attribution questions in a true, very formal fashion, you need a research study, and those are very expensive. And frankly, do we care? Like, if we are actually seeing these improvements in the community, how much do we care about that attribution? Donors sometimes care too much about this, but if this is a collective effort, all the better if we're seeing those results. It doesn't really matter if it was your organization or my organization or everybody working together with the community. And we need to push back. I think we need to push back against that. It's not that, measuring attribution should not happen. As much as possible, we need to try and measure attribution, but it should not be like the overarching most important question either, in my opinion. So yes, it's tricky. And, I don't want to just be sitting here and saying, hey, do this, do that. That's not at all my intention. We're all learning here together. And I still face all of these challenges, every week or every month when we work with organizations. So it is hard. Great. So over to you. I want to hear, your insights, your questions. Oh, thank you. That's awesome. Why are we seeing the comments in big? There you go. Your questions, your comments, feel free to type in the chat. I think we have some questions already coming in. Yes. How to identify and measure indicators when it comes to policy influencing and advocacy when we want to focus the tracking at the outcome level? What are some of the methods and tools that can be used? That's very interesting. I don't know that I've seen a lot of frameworks for that, but I don't work a lot at the policy level. There are some great advocacy organizations. One, it's called the Global Health Advocacy Incubator, I think. I can share that with you, Elam. And they have developed quite a few tools and quite a few indicators. But I think there's still a lot, and this is maybe because I'm not in the policy space, but I think we still have a lot to learn about what actually can influence policy. Some of the things that I've seen working at the government level is having champions that are political leaders, for instance. So you could measure, how many champions do you have for your cause? You could measure some of the other things we're seeing, especially in pandemic and epidemic preparedness, is that it's important, if you're advocating for domestic funding for epidemic preparedness, that your advocacy plan is aligned with the budget cycles of the government, right? And it's similar with donors. If you're sending in a proposal when they're not looking for proposals, or if you're trying to advocate for more funding when this is not being discussed in the Senate or in whatever government structure you have, it's not going to work, because by the time budget discussions come around, they're going to have forgotten about your advocacy efforts, right? So see, these are some of the things I'm seeing that work, especially in epidemic and pandemic preparedness. But yeah, as I said, I'm not very much in the policy space, so there probably are more tools and indicators. I'm happy to look into those and share. Candela, great presentation. Thank you very much. Hi, Jorge. So good to see you. I have a question about mistake 1. Is there a question and method that you could share to have the correct outcome that we should measure? I think it depends on the results that you want to see, right? So you normally start with either objectives or results, and are your high level things that your project wants to achieve. And from there, you're going to break it down. Okay, what's the one level down, right? If I want to improve breastfeeding in this community, what needs to happen one step below? How is that going to be seen one step below? Maybe women will have, the correct spaces to be able to breastfeed calmly in their workplaces, or they might have the correct information about how breastfeeding is important for the development of their child. So there's all of these previous steps that are at the outcome level that we might want to measure. And then what are you going to put in and what is going to come out of that? And that is your output level, right? This is, I'm going to teach them, I'm going to do at the hospital, we're going to have these mother groups where we're going to discuss the importance of breastfeeding. And we're going to bring mothers who are second or third time mothers who have breastfed their children to tell about their experience. And we're going to make it easier for women to breastfeed by having a nurse or a lactation consultant explaining to them the correct positions for attaching the baby, etc. Right? So all of these things need to happen in order for women to have the right tools and information to breastfeed their babies, so that you can reach your objective about increasing breastfeeding, right? So you need to start from your results and then sort of work backwards from there. And the best way to do this, in my opinion, is through a logical framework or a theory of change. And the best way to build a logical framework or a theory of change is as a group, as a team. You need to have more than one brain working on this. You need to have more than one pair of eyes. Never attempt to do a logical framework or a theory of change on your own. Do it as a team exercise. You will see so many things that you had missed in the beginning. That's my best advice. I think I'm getting lost in the questions here, guys. Wait a second. Let me go back. There you go. Yes. Do you have any method or advice to invite people to complete the trackers or complete the surveys? It really depends how you're launching these trackers or these surveys. One of the things that work best is having an actual person implementing these surveys. We are all human beings and we have a hard time saying no when someone's asking a favor from us, especially if it's the same person who's actually providing us a service. That has challenges because if you want an honest response, you also want people to feel comfortable enough to give you an honest feedback. So if the nurse that is, seeing them at the community health center is also the one giving them the survey, that might not work. But you might have a separate person saying, hey, we're checking on the quality and we really care about your input. So actually saying that out loud, how much we care about people's input, can be very good. You can use gatherings, you can use meetings. It depends who are you applying the survey to, but using gatherings or meetings or actually carrying out these surveys during a training or at the end of a training can give you better results than just sending it out to the world, right? Setting a deadline also helps, and sending several reminders. People are busy, so if you're going via their emails, that might not work. In my experience, going through WhatsApp, for example, gives you much better results in countries where WhatsApp is widely used instead of going via email, for instance, because it seems very easy on your phone to answer the survey, right? So there's a lot of tips and tricks to improve your survey responses, but yes, it's very rare that you get a full 100% of responders in any survey. Fatma is asking, how can I ensure that my selected indicators are sufficient to measure the outcomes effectively? Well, I would say, what are your main outcomes? You need to have at least one indicator per main outcome, and then you can think about dimensions. And some dimensions can be cross-cutting for all your outcomes, right? Like gender. If you have like a focus on gender, you might have an indicator or a disaggregation of your indicator based on gender. You might be interested in disability or other cross-cutting themes or cross-cutting dimensions that you want to measure across all your outcomes. But first, you need, for all your key outcomes, at least one indicator. You can turn it into two Or three, if you want to measure, for example, quality or coverage. Um, so not just the outcome per se, but how well is this, how happy are people with this outcome, right? Or how much of a population we are covering, or what geographic locations we're covering. We might not be covering the same proportion of people in different locations, and that might be something that is important for you to understand. So some of the most common sort of cross-cutting dimensions, I would say, are coverage, quality, gender, disability, other things related to protection, gender inclusion, etc., that might be important to look at. So you have your outcomes, one for each of your results, the results that you want to achieve, and then you sort of use those cross-cutting dimensions that are important for your organization or your project to say, okay, I need a few more outcomes here, a few more indicators to measure these outcomes in a more comprehensive way. So I hope that helps. And what I would say is, as similar, discuss it with other people, and that will give you a better idea than if you're just working on it yourself. My project works with sexually exploited women. What types of indicators can I include to measure impact effectively? I am not working in that space in particular, but some good sources of proven indicators that I like, that have been measuring for years by many organizations, you can find in the WHO global database repository for health in particular, but also for other things. You can find good indicators in the Global Fund. So the Global Fund, for all the thematics of the Global Fund, which is HIV, tuberculosis, and malaria, but also health system strengthening, you can find great indicators there. I'm guessing some of the bigger organizations working in gender issues might have good indicators for what your project is working on. And I would recommend checking UNDP indicators, for instance. UNICEF has a great set of indicators as well that you can look at. Many of the UN organizations have good indicators that can be a starting source for you, but also the bigger NGOs and the bigger foundations or donor organizations have developed good indicators that they have tested. So those are normally my go-to sources. And another important thing that we sometimes forget is many governments already have their own indicators, right? If a country has a health or a gender strategic plan, they might have developed indicators that they want to measure at the impact level. And you aligning with those indicators might be really relevant. So do go take a look at whatever the health strategy or the health plan or the gender strategy or the gender plan for that country is. I've seen some really good ones, actually. Okay. Thank you very much for this webinar. Oh, thank you for being here, Henry. How would you apply this in an emergency setting? As a former donor, I know our agency leadership was often interested in impact in an outbreak response. The outputs I developed would only highlight so much, and the framework I created had opportunities for such outcome indicators, but would need baseline info. This is very true. It gets a lot trickier in emergencies. That said, most emergencies do have a rapid assessment or a rapid health assessment at the start, right? And for outbreaks, I mean, normally there's either, there's an endemic level of the disease or there's zero disease. So you have that baseline in a way. You can have that. If it's an endemic disease, what we normally can use as a baseline is the baseline for that particular time of the year, right? Because, I don't know, malaria or dengue or other infectious diseases might be very seasonal. So you can't use like the full year baseline, but you could use the baseline for, the average of the previous years for those same months. Or something similar. And normally your epidemiologist would be able to tell you this information. Other sources of good baseline data when you don't have time to collect baseline are many countries have, I hope these will not disappear, but it looks like they might, the demographic and health surveys, or DHS. And these go down to the district level. So if you don't know about these, DHAs are great sources of data at the within country level of disaggregation. So you can go all the way to district data. Less reliable or less formal ways of gathering data in an emergency can also be talking to the people and the community leaders in the community and saying how many, or the nurses in the community or the community health workers, and saying how many cases that look like this case have you seen in the past 2 months, right? Communities know what's happening in their communities. That's always been my main finding. They know when something is off. They know when something is different. So these will not be, formal baselines, but it can give you an approximation as for that. And in an emergency setting, if it's an outbreak, what you're trying to look at is a decrease in cases, right? So going back to that baseline or to those no cases might be good. But there's other good proxies that you can use. If you can't really be sure, for example, about the death or cases in the community, you might want to measure deaths or cases among healthcare workers. This is a great proxy. It was very much used during COVID around the world. Because healthcare workers are sort of your red flag. If there's starting to be cases in your healthcare workers, then in what's happening in the community is really serious already, right? So yeah, I hope that helps. I'm happy to share more, but that's a very specific question. Measuring an impact indicator, Yasu, measuring an impact indicator is very difficult. Could you share your experience in measuring it? Yes, it is. You can measure decrease in number of deaths, but you need to have, impact is normally measured in health as decreased mortality or morbidity, right? In a specific community or a specific group of people. It is difficult to measure. It's not impossible. You need good baselines and good end lines and good data collection. But yes, you would need definitely a baseline and an end line. And if you can't have this, other ways of doing this is by comparing communities, for example, changes between communities that had the intervention and that did not have the intervention. And one thing I would like to say, I don't have a lot of time because I just want to present the last 2 slides, but in academia, people love doing this. People would love to help you measure impact, the impact of your project. In academic settings, people are really interested in being able to get their hands on real world data. Sometimes there's a communication issue because we speak different languages, and I've been in both, so I speak both languages. But if you can find academic partners that can support your organization to set up a good research project to measure impact, that's great. I think it'll make both parties very happy. And they have access to certain donors for research purposes that we as implementing organizations might not have access to. So always look around and try to find some people to talk to who are in the academic world, especially in global or public health, who might be interested in partnering with you for this. Great. We are 5 minutes out and I want to finish on time. So thank you so much for all your questions. This has been a super interesting discussion. I just wanted to present how we at Alandra think about evidence. And hopefully this little figure can help you think more clearly about evidence in your own projects. We think about the 3 E's of evidence: evidence-based, evidence generating, and evidence sharing. When we think about the evidence base, we ask the question, is this project based on the best available evidence of what works? Oh my, what am I doing? There you go. That means, if you're planning an intervention, has this intervention been tested somewhere else? And what is the data on whether it works or not? That's a great step to do before writing your concept note or before designing your project. That's, carrying out a serious literature review, etc. And then understanding what has happened in that community in particular through a needs assessment or other tools is also very important to understand the context that you'll be working with. More and more donors are requesting this step, are requesting needs assessment, but I still see a lot of projects that skip this important step. The other thing we do at Alanda is concerning the evidence generation. If you are starting a new intervention or an innovation, or even something that you've done in the past, are you setting up the right tools to be able to measure impact or outcomes if you don't want to measure at the impact level? And that means, do you have your monitoring and evaluation framework in place? Do you have the right data collection tools? Have you trained your people repeatedly, not just a one-off training, to collect the data appropriately? Is everybody collecting data in the same way, right? And you've seen this a lot as well, as I have, I guess. So that is, when you're planning your project and when you're starting the monitoring of your project, and you might need a baseline at the beginning, and that needs to happen before implementation happens. And normally, projects just start off and the baseline gets forgotten. So this is very important. And the last question we ask, and this is, I think, the first circle, evidence-based organizations are getting better and better at this. Evidence generation, we're doing well. There's areas of opportunities. The last part, evidence sharing, is, in my opinion, the weakest one still. It's the weakest link. Are you sharing data with peers? And that means other organizations working in the same space. Are they also benefiting from your data and you from their data on what works and what doesn't work? There is not so much tradition in the not-for-profit world, in the NGO world, to share data through conferences, through publications. Normally, we just share data back to our donors, but our peers could also use this data to improve their own projects. And we're all working towards a common goal, right? And of course, end users and communities. And there's so few projects that share data back to their end users and their communities, right? I mean, if you work at a hospital or at a healthcare center, it shouldn't be that hard. But even if you work at the community level, you can have your volunteers or your community health workers organize a couple of sessions with your communities to share the data back. This will create more engagement, more accountability, and more buy-in. So at Alanda, we work a lot on helping organizations reinforce evidence across the project cycle in these three spheres that we've talked about. So if you ever need help or support, we're happy to help further. And you can always, if you have a specific challenge that you want to discuss and see whether Alanda can support your organization, please feel free to book a call with me. There's a link there. We're going to be sharing this slideshow and the recording, and you can, I think my team will be putting in the chat the link to book a call with me. Please just use it to book a call about M&E. If you want to talk about anything else, just ping me on LinkedIn and I'm happy to set up a time. Thank you so much, everybody, for being here. I hope this was useful. And if you have 1 more minute to spare, I'd love you to answer one single question about what would you like us to talk about in the next webinar, because we're thinking about making these a recurrent feature of what we do at Alanda, so that we have a better communication with all of you. So let me know, and if you answer other, please feel free to type in the chat. That would be awesome. And if I couldn't answer your question, we'll do our best to be answering them in the follow-up email where you'll get the recording tomorrow. And we'll be using your questions and trying to answer those on LinkedIn as well. So stay tuned. If you're not following Alanda on LinkedIn, please do. And we'll be trying our best to answer all your questions because we really appreciate each of them. Great. Thank you, everyone. Thank you so much for joining and for being here today. I'm going to close the poll and end the voting. You can always reach out to us on projects@alandahealth.com. If you have other suggestions, we'd love to hear about those. Thank you so much for your answers and for being here and for all your great questions. And we'll be definitely organizing another one of these. Have a great day, everyone.